Dentistry is, in fact, a
Is
business.
dentistry the
And
biggest
in order for a
scam
dentist to survive,
in the United States? This is the question that we're going to address today. I'm Dr. Mo. I'm a licensed dentist, and I will be reacting to this documentary called Dollars and Dentists. Before we start, look at the first line written in this description, and that is dental care can be a matter of life or death. Yet millions of Americans either don't have dental insurance or simply can't afford to see a dentist. The result? Severe pain, preventable disease, humiliation, bankruptcy, and sometimes even death. Well, that is a bold statement. Let's see if that's true or not. I'll be giving an unbiased opinion as a dentist. Welcome to the channel. Don't forget to throw a like, comment, and share the video in the end if you like it. Let's watch together.
Tonight, two reports on this special
So they're
edition of
saying no
Frontline.
dentist
A dental care
wants, or
crisis in
at least
America.
claiming,
No dentist wants seeing children
pediatric
on
patients or
Medicaid.
For
kids
children.
even
Her
on
teeth are infected.
Medicaid, which is extremely unfortunate. Like, what are they supposed to do? Dental treatment is extremely expensive.
Has a lot of pain with them.
And adults.
I've been to the ER 3 times within the last 6 months. I can't take the pain. It's too
A little
excruciating.
bit off
Corporate
topic,
chains
so
filling
as
the
a
gaps.
dentist or as a healthcare professional,
Look at them real quick.
never,
Typical
ever,
patient
okay?
is probably
Be wearing
45 to 60.
gloves, I don't care, clean gloves, contaminate gloves, and hold your mask and put it up like this. Again, it's me, I wouldn't say being a bit OCD, but just don't do this. Some of the teeth are mobile. This is like as a consequence of advanced periodontal disease. Periodontal disease, we talked a lot about in the channel, which normally starts as gum disease and then progresses into the supporting bone, etc., leading to mobile teeth.
Just to make ends meet.
Or taking advantage of people
One
in
of the
pain.
patients
She came
owed
home after one day,
replaced
and she owed
$8,000.
$8,000. $8,000 is close to 50% of her annual income.
Tonight, Frontline correspondent Miles O'Brien, in collaboration with the Center for Public Integrity,
Are profits and patient care always at odds?
investigates this unreported health crisis.
We had whistleblowers that
So
gave us
what they're
information of
claiming
what they
also,
thought was not only
not
bad
only
dentistry,
there
but
issues
also a waste
from
of
the
taxpayers'
monetary
dollars.
side, but also there was a bad dentistry, bad technical clinical dentistry being practiced, which is quite interesting.
This is a crisis, and we need to fix it.
Dollars and dentists on this special
Awesome.
edition of Frontline.
Good afternoon, folks. We're going to start in about 2 or 3 minutes' time.
So
Very glad to have you.
Almost all of the men and women in this
to be
line
completely
are in
honest,
pain.
no patients should be waiting in this
But like millions of other
way, just
Americans,
like outside.
regular doctors can't help them. And even a visit to the emergency room would be useless.
Got a couple of cavities and a couple of molars that's got to come out.
I tried going to dentist, they just too much out of pocket.
Those of you that are here to see the dentist, please raise your hand.
A few of the 100 million Americans without dental insurance have come here to Grundy, Virginia.
Okay, thank you.
A charity called Remote Area Medical is staging a health fair where volunteer dentists are offering free care.
So apparently
We just
these
want to know,
are
where does it
American
hurt?
citizens
And we're
and
trying
they
to do
don't
the best
have
we can
dental
for you.
insurance, so they
Even though many people
organize
here have jobs,
like a charity for them to get treatment. So this sort of just addresses, I mean, clearly looks like it's for an altruistic cause. However, it also addresses that how expensive is dental care for them and how they need to go through this just to get a dental checkup even, or let alone an actual dental treatment.
jobs. They can't afford healthy teeth.
Yeah, I can't eat on the whole right side of my mouth. It's like chewing on gravel. It hurts so much I can't even eat ice cream on that side. I can't eat chips on that side. I can't eat a hamburger on that side. I can't eat anything on the right
A
side
little
of my
bit
mouth.
off topic again. So
Many
notice
retirees
how
simply
when you
live with the
lose
pain and
significant number
infection
of your
because
teeth,
traditional Medicare
it's
does not
normally
cover
followed
dentistry.
by bone loss, and that the combination of losing teeth and the like remodeling actually and loss of bone may lead to that sort of appearance that you see like old individuals have. Yeah, as the gentleman said, what he is hoping for to remove some
Well,
of
I'm
the
just hoping they
remaining
can stack my
hopeless
teeth
teeth and to get a
give me a
denture.
set of
It's
dentures.
not only to help with functionality in eating, but also supports your lips and facial structure.
Dr. Terry Dickinson started the dental program after realizing how many people needed help.
They don't have any benefit. So it's what do you do with the dollars that you get? I mean, you're going to put it in gas? Are you going to pay the rent? Are you going to put food on the table? What are you going to do with those dollars? Dentistry is not on the top 10.
I've been trying for like over 10-something years to try to get help.
Vanessa Nations traveled 8 hours from her home near Washington, D.C. to get here.
I have a lot of teeth that are broken off at the gum line, and they hurt tremendously, and I can't eat. I've lost so much weight, I cannot eat, and keep getting infections. I just can't live like this anymore. I really can't. I feel like I've got
So
little bits
Vanessa's
of
situation
poison
is
inside of
actually
me,
extremely
and it's
devastating.
killing
She
me.
had to drive 8
Vanessa's
hours
situation,
to
like
this
that of many others here,
surgical avenue just to get her teeth checked, and she describes it as she's feeling there's like a poison in her mouth that is just progressing. Now it's not a poison, obviously, she's just describing it that way. I mean, I know that this is primarily for charitable cause, but
but this
definitely
makeshift clinic
partitions,
has
like
limited
sort of
solutions to
walls,
offer.
not
It cannot
expensive
do
walls
crowns.
between patients, just at least for privacy purposes. I mean, sure, these patients are coming to get a treatment for free, etc. But I mean, I don't know, just I think patients' privacy is still important.
Or bridge
So for a clinic, I mean, that's a
The
setup
only
for
option
charitable
for
cause,
Vanessa
and what
is to
they
have
just
all
put
of her
that it
remaining
looks
teeth
like
extracted.
for nitrous oxide sedation. I mean, this is really good for like a charity
The only
clinic.
option for Vanessa is to have
Oh god.
all of her remaining teeth extracted.
What was that? I'll take out 5 teeth today.
Nothing we can do except take out the rest of her teeth.
I'm just excited just to have the teeth that are hurting taken out.
Okay, here we go. 1, 2, 3.
But Terry Dickinson is also promising Vanessa that once all of her teeth are pulled, his charity will see to it that she gets dentures.
She'll look better, obviously. So it's going to help her self-image. She's going to be able to eat better. She'll be able to talk better. So it's going to, essentially give her a change in her life.
That's the baby Nemo.
That does look like Nemo, don't it? Mm-hmm.
For many Americans, like 5-year-old Trinity Way, trouble getting dental care starts early in childhood.
Ooh, yeah, he's hiding.
We met
So
Trinity and her
pediatric
grandmother Pamela Way
patients
in the waiting room at
is
the
one of the
hospital
most
at the
difficult to
University of
deal with,
Florida
yet
in Gainesville.
in my opinion, one of the most
I have brightened up a flower.
critical patients to treat, because if you
Her
teach them
teeth
how
has
to do
gotten
things
bad.
from a very young
They
age,
are.
that can prevent a lot of issues like advancing cases into situation like Vanessa and other patients we saw.
Are infected. She has a lot of pain with them, and on the side of her cheek will get real warm, you know, and I'm sure that's from being infected.
When's the last time she ate or drank?
About 9 o'clock last night.
Great.
Last 2 years I've been trying to get her in because she had it started out just discoloration on her teeth. I've called around 10 dentists in the area to see if they could see
It's
her,
honestly
but
extremely sad
she's
and
on Medicaid
devastating. I
and
mean, she
I
has
couldn't get her
Medicaid
in.
insurance, and I'm assuming the legal guardian here, her mom tried to get her to a bunch of clinics, and they refused just because she has Medicaid, and of course, being out of pocket, extremely expensive.
Can I have a kiss? I love you, girl. She's been on a waiting list here. It's gonna be fine. It's okay. Don't cry. Don't cry.
Pediatric dentist Frank Catalanato is a faculty member here.
1,200 children a year in Florida get their dental care under general anesthesia in a hospital. That's an enormous number.
So if you're surprised for seeing pediatric patients getting treatment under general anesthesia, will explain to you that it's actually a completely normal thing and there are indications for it. So there are certain patients that are like uncooperative or they're like semi-cooperative, but they need extensive treatment for all quadrants of their teeth. There's numerous multiple indications for general anesthesia, but he seemed to be describing it as he's surprised with the number of general anesthesia done. Now, mind you, general anesthesia out of other options of anesthesia is actually very expensive, and there's certain insurances that cover it. And as these insurances cover it, unfortunately, some pediatric dentists, yes, abuse this for monetary costs.
Dr. Catalanato says kids wind up here because Florida's Medicaid system is broken, thanks to one of the lowest reimbursement rates for dentists in the nation.
So there aren't many dentists who
Only 10% of Florida dentists participate in the Medicaid program.
Wow.
That's awful.
That's a lot of underserved people.
So the
I mean,
result
I
is
don't
that
really
only
know if some
25% of
people or
Medicaid
some
eligible
healthcare
children
rather
get any kind of
professional
dental
or
care. And by
people
any
say
kind of
like
dental care, I mean
flat
one
out,
visit a
oh,
year.
dentistry is
Dentistry
like a
is,
business.
in
Of
fact,
course, the dental
a
practice
business.
has its
And in order
income,
for a dentist to survive,
expenses, legal documents, etc. So I'm not telling you that is non-existent, but just to flout out describe it as a business, I think it's just, I don't know, you could describe it in a better way.
they need to be able to make money.
Dr. Cesar Sabates is a practicing dentist and president of the Florida Dental Association.
I looked into becoming a Medicaid provider because I do believe in giving back. And I noticed that the reimbursement schedule was dismal, to be quite honest with you. It was maybe 20% of what we would normally charge. So I thought to myself, this doesn't make any sense. It's not the dentist's fault.
But whoever's fault it is, Trinity Way's dental care will now cost $18,000.
For pennies on the dollar, preventive services on Medicaid rates would cost between $50 and $60 a visit.
Pay me now or pay me later.
That's exactly right. And then, in addition, you don't have the pain and suffering. You don't have the missed school days. You don't have the missed work days. You don't have the potential deaths.
The stakes are high. Half of all children in this country rely on Medicaid or state insurance.
Occurring in the poor, we don't know all the reasons why. You just simply don't know. But the numbers are huge.
Is it accurate to say dentists are
So
seeing
if
more
I'm happy
cavities
with
than
the
ever?
existing
I think it is accurate
general
to say that, yes,
insurance
this is a
coverage
crisis
and
and
healthcare
we need to
system, and
fix it.
there's
We
a
need
lot
to
of
fix this
doctors
by
actually in the
education,
United
by
States,
money, and by
dentists and
organizing a new
otherwise,
system of care.
who also complain of this.
With neither government
So when asking pediatric
nor
patients
private
where
dentists
where
able to
it is
solve the
hurting you,
problem,
normally they
a
actually
new
give
system of
did
care has
not give
emerged in
an
recent
accurate
years.
answer, and obviously we not rely on this. But whenever, let's say, they point down,
If Trinity
so
Way
we
lived in
know at
Maryland,
least that like with high probability, one of these teeth is the accused tooth. That being said, for every patient, pediatric and otherwise, we must do a comprehensive full mouth checkup for all teeth actually, because you could be feeling some pain down, but the source of pain is actually one of the upper teeth, and there's a phenomenon that's called referred pain. So there are patients, kids or otherwise, that also freak out when we decline the chairs. It's amusing.
she could
They
have come
they
here
feel they're
to
about to
Cool
fall.
Smiles, a dental chain started just to treat kids on Medicaid.
Even 12 years old. And they've never been to a dentist before. We come through here.
We met one of their executives, Dr. Polly Bucky, at a clinic in Baltimore.
So this is all hygiene, right?
This is what we would consider our hygiene bay. We're in an open bay concept.
Sophisticated.
Each Cool Smiles office sees thousands of patients a year.
These are individual treatment rooms. It's okay.
Its size
health record
and its sophisticated computer system allow Cool Smiles to be successful, even on what Medicaid pays.
We started in 2002 in 2 offices in the Atlanta area, and today we're up to about 129 offices.
Smiles by a private equity firm. The company is flourishing in states that have raised Medicaid rates in hopes of getting care to more kids. States like Virginia, where Cool Smiles opened 12 offices.
It was exciting. I mean, this area didn't have a whole lot of dentists that accepted Medicaid. They were trying to reach out to the population that wasn't necessarily having an easy access to dental care. And so that's what appealed to me.
Christina Bound was an experienced dental assistant who in 2006 became office manager of a Cool Smiles. At this chain,
We had to meet each day. So they would tell us if we had to make $15,000, that's what we had to make each day. Community, but more about numbers. It became as what we were doing to help the community, but more about numbers. It became where we had a goal that we had to meet each day. So they would tell us if we had to make $15,000, that's what we had to make, regardless of how we got there.
This
Christina
is
says that
exactly
the
why I
company
made this
computer
video
system
reacting
tracks
to this
production in
documentary,
minute
because
detail.
it's not only
It would
within the
tell you
context of this
if
cool
you're seeing enough
thing,
patients,
cool as in the name
and
of
doing
that
enough procedures.
practice, what they're doing in tracking the production as in like how much is this dentist producing of income to the practice owner, but rather this is a more widely spread phenomenon, and dentists, especially employed dentists and staff dentists, they are being tracked as to like how many dollars they're producing per day, per week, bi-weekly, on a monthly basis. Even now it became worse in some practices. They are going as far as like how much income or revenue per individual patient, like per one patient. They're like, okay, how much like per one or two patient. Honestly, it is quite disappointing. Like, yeah.
I asked Dr. Bucky if any pressures were coming from the private equity investors trying to increase profits.
Our policy actually is
Presumably, if private equity owns NCDR, which operates these operations, there is a lot of profit in Medicaid patients, right?
The focus for us, again, is to provide a quality dental care, to provide a quality dental home. The fact that we have a group that wants to see us be successful, part of what they can value is the fact that we are continuing to expand access to care. We're continuing to grow our business.
Done. She didn't cry. She wasn't scared. She was smiling. A fill the next time to down here. And we were supposed to go back the next time to get Marissa's 4 front teeth taken care of, just fill-ins.
But the next visit was not as good an experience. First, she was assigned to a different dentist who wanted to change the treatment plan.
Dr. Collins just felt like she should do the crowns instead. She didn't feel comfortable doing fill-ins because she felt like the fill-ins would fall out.
Dr. Collins wanted to fit white-fronted New Smile stainless steel crowns on Marissa. According to former employees, this was not unusual at Cool Smiles. They say the chain encouraged its dentists to use crowns.
The reimbursement for stainless steel crown is much more than a filling.
How much more?
About 50% more.
They do a lot more,
So,
a lot of procedures. Crowns and everything.
Frontline and the Center for Public
So
Integrity
what's
have
happening
spent the
is
past year
they're
investigating
kind
the
of
business of
allegedly,
Medicaid
again,
dentistry
this is a
and the
documentary
new
we're
corporate
trusting what
model
they're
for
saying.
treating
So they're
America's
pressuring
poor kids.
the dentists there to do the crowns they mentioned instead of simple fillings. Now, there are legitimate cases where crowns are indicated instead of fillings. However, if there is like a trend where the dentists are being pressured to do a more expensive, a more income-producing treatment with no logical healthcare rationale and ethics being thrown out of the window, of course, it's extremely devastating to hear that something like this is happening. This does not only happen with kids, but even with adults. There are certain practices that pressure the dentist to do similar things.
We were able to obtain and analyze Medicaid data from 2 states, Virginia and Texas. We found that, on average, Cool Smiles used crowns more frequently than other providers on children 8 and under.
In Texas, half of all the restorative care on kids 8 and under stainless steel crowns, 50% more than the state average. Virginia, 50% more crowns than average. That's a big difference than other Medicaid providers. Why?
Our focus is looking at each and every child and looking at where their decay is, what their risk for getting cavities.
It's not because the crown pays more.
The focus on each and every child we see is to restore that child to a state of good oral health.
Then how do you explain that discrepancy, that difference?
All I can tell you is what we do. I can't tell you what someone else does.
So he was
Cool
digging
Smiles
into
later
the
gave us
crowns
data
reason,
comparing itself favorably
and
to
the
other
recipient
providers.
woman
The
was
company
in
did not address whether
denial.
kids who visit Cool Smiles
And
are
not
more
only
likely
this,
to
but they
leave
also
with a
prepared
crown.
reports defending their
Carrie
case
Reyes was
against
not
those
happy.
claims, and they were sort of kind of a bit disregarding the whole talk about the crowns.
When Marissa went to get her crowns.
So of course
The
that should
doctor was
never
shoving
happen.
the
An
crown
experience
into
for
Marissa's
replacing
gums, and
crown
her
for
gums
kids
were
or
bleeding
adults shouldn't
just
be as
everywhere. She
horrible
started
as this.
screaming like painful, like a shrieking, painful, scary scream for a mother.
Carrie says she thought Marissa's local anesthetic had worn off.
I asked Dr. Collins, I said, could you stop and numb her mouth? She ignored me. So I, just kind of sat there and I was rubbing Marissa's legs and she's crying and screaming this whole time.
New dentist came in, gave Marissa another shot, and after 3 more attempts, new dentist came, asked the doctor to stop working on Marissa. A new dentist came in, gave Marissa another shot, and after 3 more attempts, got the crown to
So
stay
she
on.
requested Vince
We
to
went
stop working.
home
Another
and
dentist
about 30
walked
minutes
in.
later, the crown falls out again.
I
This
mean,
tooth right here.
yeah, she's worried
This front tooth.
about the
But
child.
Cool Smiles dentist eventually did get the crown to stay put. With one tooth left to treat, Cool Smiles referred Marissa to another dentist.
This is the tooth that they didn't get done, and he just scraped the spot that was thought to be a cavity with his tool and just scraped it off. It was like a stain. He couldn't tell
Okay,
me for
so
sure if she did need
this is
the
an
work that was
issue of
done, but
patient
just seeing that one
education.
spot on her
Okay,
tooth
perhaps
really
he was
made me question, just
the
made me
dentist was
and
actually
him question
suspecting
the entire thing.
some initial decay or demineralization on the tooth. When treating a kid or even adult, you should very, very clearly communicate what you're doing. Why is it necessary? If it's not necessary, why is it optional? Then what kind of value does that treatment provide, and what are the disadvantages? What are the risks associated with this treatment you're providing?
Dr. Collins defended her care. Reyes overreacted. It was appropriate and in compliance with professional guidelines, and said it was a rare case. In addition, the company said Carrie Reyes overreacted, exhibiting threatening behavior toward Dr. Collins, which Carrie denies.
I'm gonna do one tooth, okay? And then you tell me. Here, open it for me.
Critics say problems arise from Cool Smiles' business model.
Close for me.
I got a
So
bonus.
the
So if I
bonus
met my
structure
goals for
is
the month,
actually
I got a
quite
bonus.
common. What
It
happens
was
is,
based
let's
on
say you
production.
have
It was based
particular
on patients.
target per month. If you
For
like,
certain employees.
if you earn more
For
than
certain
that
employees.
target, then there are some reps who would provide you a contract with a bonus on that basis.
Looking at the office managers, you're looking at your doctors, and then their supervisors that I was aware of.
Our dentists come in and they're salaried, and so they're focused on coming in.
There's no bonus?
They're coming in, they're focused on a salary, and we do have a bonus that's a quality qualifier.
But doctors and office managers don't get bonuses based on quality. It's more on quantity.
Actually, that's incorrect.
But there is a daily revenue target, right?
Our focus each and every day with our dentists is to provide quality care to the children that walk in that door.
I'm trying to figure out, there are revenue targets, right?
For our dentists, there are not.
This is the Cool Smiles associate dentist. This is the bonus plan
So,
for Texas.
if you remember a bit ago, I
And
did
this is
say
from
there's certain
2008.
practices
Our
who
investigation showed that Cool Smiles
will give a
bases
bonus
dentist
once you
bonuses
surpass
on the
certain
revenue they bring
thresholds
in
of
once a
income.
certain
Now,
threshold
that
is
woman
reached.
seemed to be PR trained and knows how to answer very specifically. The interviewer, like, his rationale is correct, but he's sort of like interrogating. It's like if you're going to say something, his style is like you're going to be legally liable or something. So she was a bit trying to be too smart with the answers, and she was like focusing quality and all of these things. Well, we can see in front of us what's going on. And she was just trying to be overly specific, while it's like the bonus is on surpassing a certain threshold. If I'm not mistaken, the interviewer asked like if they have a daily revenue or income target. So she's like, oh no, they don't. What?
Double the mandatory minimum, busy day, you get a $6,300 bonus.
Mm-hmm.
Now, at $5,500 a day, how busy is that dentist?
She's broken. She's on roller skates.
Since our interview, the company acknowledged that their
$1,500
dentists
a
could
day
get
is-
production-based.
honestly, it's achievable. It's not like unethical something. If you have a busy practice, what I'm trying to say is you could be practicing ethically and seeing patients normally and treating things that they actually need to be done. It's manageable.
Bonuses after meeting quality standards. Cool Smiles would not grant any on-camera interviews besides Dr. Bucky, but they provided this lengthy document. Cool Smiles said it delivers millions of dollars of free care each year and improves oral health in the communities it serves. The company's internal surveys show 3 out of 4 patients are satisfied enough to return. In 2008, the state of Connecticut dramatically raised Medicaid rates. New providers, including Cool Smiles, came into the state to treat poor children. But officials noticed a change in the kind of care kids got.
What did you see? What happened?
We saw spikes in the types of services that historically can be a red flag. Good afternoon, Department of Social Services.
Dr. Donna Belasky is the
Before
director
we
of
proceed,
Connecticut's dental
why
Medicaid
would
program.
a insurance provider significantly increase, or at least that's what I heard, like really increase the rates? Do they mean the rates that they're going to reimburse or compensate the clinic? And they're shocked that they saw some dentists abusing this?
We saw a higher than normal number of stainless steel crowns being performed. A huge increase, disproportionate to the numbers of treatments that children were getting.
So people were being overtreated here.
We felt that.
Connecticut then began a process revealed she showed us an x-ray of a child's root canal.
It's not filled properly.
So it's actually not the
Notice
root
an
canal,
X-ray
this
of
is
a
a
child's root
phlebotomy
canal.
procedure. He's talking about the filling in relation to the crown, the part that's visible to you, that the filling is not properly being placed.
Are some poorly done crowns.
They look like they don't fit.
They're
properly.
talking
That's
about
correct.
these
There's
gaps, right? As in, and also not only gap, but when you see this like angle and it's already far from the tooth structure, that's also called an overhang. Why is this problematic? This is problematic because there's going to be food and debris being stuck. Now, mind you, I'm not defending anyone, and these crowns could be adjusted to fit in, but what I would say also that these are not custom made, these are prefabricated crowns. And the dentist, there's a tool that he uses in order to adjust the edges of these crowns so that they fit well. And there's criteria that we follow before doing the final cementation or like a gluing of that crown. Yeah, like this.
Are open on this one, and food can get up and stuck underneath.
Something like this, if you claim to have internal quality control,
right?
Is this obvious?
Yeah. Yes.
It's screaming at you.
To me, it does.
You talk about quality. I'm curious, how do you measure quality here?
We're going in and doing self-audits. On top of that, we have external auditors to look and see that we're providing quality care, that we're doing the right thing.
So show me how it works.
I'll show you here.
To do quality audits, Cool Smiles says it relies on its electronic health record.
So we're able to keep the records of each child and keep it all together in one spot. And it will help us as we go through.
You can look at the records and really decide, oh, that's a good dentist or a bad dentist just by looking at the records?
I can go in and look at a chart and look and see based on x-rays if the treatment plan was appropriate for that child.
Did you see much evidence that there was quality control?
Initially, no. We absolutely did not see any quality at all. And in fact, when we called them into the room and started showing them examples of their work, they acknowledged that it was substandard work. So if they were checking on it, why were we seeing that kind of substandard work?
Connecticut regulators say that they have seen significant improvement by Cool Smiles over the past year and a half. Ever since the state sent the company this letter, referring to some of its care as
legal
malpractice.
Statement putting Cool Smiles in legal liability. So they started actually auditing and improving their
Failed to achieve expected standards of care, malpractice, of course, poor quality of dental care, practice without regard to medical necessity. This is a very strong letter, isn't it?
It is. We take our clients seriously. We're here to protect them.
They took advantage of you.
They took advantage of the system. I mean, a lot of people do it. It's not unique to just Cool Smiles.
It's a Medicaid gold mine, and they're drilling for your tax dollars.
Another private equity-backed kids dental chain, Small Smiles, was the subject of this 2007 report that led to a $24 million settlement with the federal government. Now, corporate dental chains have become the subject of a Senate investigation.
When private equity firms get involved, you got to understand that their motivation is to make money.
Senator Charles Grassley says it's tough for the government to encourage
So
providers on the one
imagine there's
hand
the
and
federal
protect patients
Senate
on the
in the
other.
United States involved in this. So this just show you the magnitude and how bad is this. And he just also mentioned that when private equity is involved, there are going to be more numbers, more profit focus, because that's probably what they know. That's why they got involved in the beginning. To provide some context, some actually unfortunate context, what I'm saying is the bigger chains are winning and the smaller practicing are rather closing, and they're struggling. So what they're doing is they're buying these smaller practices.
We had whistleblowers that came to us and gave us information of what they thought was not only bad dentistry delivery and bad health care, but also a waste of taxpayers' dollars.
Are profits and patient care always at odds, you think?
Well, to some extent, yes. There ought to be complete, good relationships between the patient and their dentist. They ought to know that the only person that dentist is concerned about is the patient. And that's not what I'm finding in this investigation. I'm finding in this investigation that there's people that know nothing about dentistry, are saying you got to see so many people, you got to do so much work for each one, and in a sense, gaming the system.
Do you think a private equity firm and the people who own that private equity firm and its shareholders care about the quality of the dentistry?
I genuinely believe they care about the quality of dentistry. You know, if people are going to invest, they're going to invest in something that's sound. And the only way for us to continue to stay here and be here is to be high quality.
Cool Smiles later wrote us to say its dentists make treatment to sound says that after she reported a dentist for mistreating kids, she was fired. She is after she reported interference from corporate management. Christina Bounds says that after she reported a dentist for mistreating kids, she was fired. She is now in a wrongful termination suit with Cool Smiles.
It should never be about money when we're treating children.
I think it's enough for today. When she reported a patient being treated badly, she got literally fired and then filed a lawsuit in that regard. I think this is a good place to end this act. Again, Dr. Mo Dentist, don't forget to subscribe, turn on the notification bell. Thank you very much for watching, and bye.